Good afternoon. My name is Darren Goss. I'm the president and CEO of the Coastal Community Foundation, and I'd like to welcome you to a look back at 1 year of COVID, what we've learned through the pandemic, what we have yet to understand about steps forward, and how we have actually been able to not only make our way through the pandemic, but in many cases support the many communities we serve in the low country of South Carolina. I'm joined today by a wonderful panel of experts, and I'll introduce them in just a minute. But wanted to just share a little bit about today's event. Edie Blakeslee, who's our Vice President of Grantmaking Community Leadership, you will hear from her in just a minute to set some context about the panel discussion this afternoon. But let me just share that this event is being hosted by the Coastal Community Foundation and the Waccamaw Community Foundation, and we are being sponsored by Blackbaud. So join me in welcoming Sally Ehrenfried, our colleague and friend from Blackbaud, to say a few words on behalf of our sponsor.
Thanks so much, Darren. My name is Sally Ehrenfried, and I lead government relations for Blackbaud. It is a pleasure to be with all of you today, and Blackbaud is very proud to support Coastal Community Foundation's Donor Education Series. Many of you may not know that Blackbaud and Coastal Community Foundation have a very long history. More than 20 years ago, our founder, Tony Bacher, created the Blackbaud Fund. And this fund supports organizations in Charleston, Berkeley, and Dorchester counties that serve children with special needs or provide educational opportunities for disadvantaged, underserved, and/or minority children. Grant applications are reviewed and funding is awarded by a committee of my colleagues. The Blackbaud Fund has not only granted hundreds of thousands of dollars over the years, but our Blackbaud Fund model has educated my colleagues on the opportunities and challenges facing those in our community, along with organizations that serve them, and has taught them what it means to be grant makers. This is a very meaningful experience when you work for a technology company that focuses solely on social good organizations. I can speak to this firsthand, as I've had the privilege of serving on the Blackbaud Fund Committee and working very closely with the committee for many years. As my work at Blackbaud has evolved over the years, so has my relationship with Coastal Community Foundation. Over the last few years, I've had the opportunity to collaborate with the team on advocacy, in particular as participants in the Southeastern Conference of Foundations on the Hill. This annual event has enabled us to work together in our outreach to South Carolina's congressional delegation. The many years we've spent walking the halls of Congress, although not this year, have resulted in strong relationships with the entire delegation. And Seth's participation today with today's panel is an example of what can happen when we take advocacy seriously. Engaging with our elected officials really does matter. It has truly been an unprecedented 13 months, and Coastal Community Foundation, as well as the panelists gathered today, have been at the forefront of assisting our communities and our state weather this COVID-19 storm. Thank you so much for joining us today, and I'm sure you're looking forward to this conversation as much as I am. Thanks, Darren.
Thank you, Sally, and thank you for all your support and work with us over the last several years, and the continued excellence to you and Blackbaud. You know, we find ourselves in a very interesting situation here as we think about COVID-19 and the pandemic. Before we jump into some of the details on that, let me just share a few things about the flow for this afternoon's event. We're into the welcome. I'll give you a brief overview of Coastal Community Foundation, maybe an introduction to some, but absolutely a refresher to others who know us. We'll spend some time talking about what we have learned. This event is a culmination event of several events we've hosted over the last year. So some information will be new, but we'll ask the panelists to sort of reflect on where we've been and really envision where we're going ahead. So they'll have a chance to introduce themselves more deeply and then share a little bit about their perspectives. Coastal Community Foundation has 4 clear value statements that really reflect our purpose for being here today. Our values of stewardship, integrity, inclusion with equity, and courage really calls us to moments like these where we read reality truthfully and endeavor to take action responsibly. We are a regional community foundation. While we're nestled and headquartered in North Charleston, South Carolina, we do have offices and affiliate foundations along the coast of South Carolina. An office in Beaufort, representing our Southern Lowcountry, and then 2 affiliate foundations, the Francis P. Bunnell Foundation in the Waccamaw area, as well as the Waccamaw Community Foundation. So here's where we are. We are 12 months and a little under 30 or 40 days removed from when the world changed dramatically. 13 months ago, we weren't necessarily going to have this meeting. I'm sitting at the Harbor Club in Charleston. Aditi is in her office. Seth is probably in Charleston thinking about what work he has to do in DC. Edie's at her home in West Ashley, and Ann is representing the state from her home. We didn't think about these things 13 months ago. We certainly didn't think that this would be an accessory that we would need to walk out of the house or to engage in business. I don't know about you, but if you invested in hand sanitizer, you probably have made a lot of money. Not to make light on where we are. The fact is, we've learned a lot. We have been resilient. We have been innovative. We have absolutely been, as a community and as a state, very intentional about producing the kind of care and concern and results, solutions that have secured so many in our great state of South Carolina. So it's a privilege to be here with you today. We're going to reflect on some of what we've learned. We're going to talk about where we think we're going, and our hope is that we will engage you who are on this call, listening in, on being a part of the solution, being the reason why. I want to turn it over to my colleague, Edie Blakeslee, who is the Vice President for Grantmaking Community Leadership at the Foundation, to ground us in where we've been and some of the data that you'll need to see as it relates to things like eviction and other issues. So, Edie, I'll turn it over to you.
Yeah, thank you, Darren. Thank you so much for that. And Gloria, we can go ahead and do the next slide, please. So as Darren said, I'm going to set a high-level overview. Some of the resources and data points and pieces of information I'll share is from a national, statewide, some of it local level, but it will absolutely set the stage for my colleagues on the panel to really dive into some very meaty subject matter, and then also allow us to have plenty of time for Q&A. So we've talked a lot about eviction, not only here in South Carolina, but nationally. And you may have seen that there is a great resource out there through Eviction Lab that really follows all of the eviction rates throughout the country. So one of the things that we posed when we presented our title for this particular session was, is this just a bump in the road? Was COVID a bump? Or is there something more? Are there more bumps? And part of our premise is that while some things may be new, we do believe that a lot of the issues that we face were prior to COVID-19 hitting. It's been exacerbated by COVID-19, but absolutely it's been there. It's not new. And the eviction is really a key indicator of that. So this slide will just show that, what we see, that generally eviction rates are pretty high. This one is broken down by gender and by race and ethnicity. And the data tells us that unfortunately persons of color experience eviction filings and also eviction judgments at a higher rate than their white counterparts. And then you'll see it's slightly higher for women in that bucket. I did want to point out too that it's essentially 1 in 4 Black renters who live in a county, if they are filed against and there's a judgment, that it's roughly about double the white eviction rates. So it's a disparity that we've seen in many areas across our footprint, not only here, but it's also a national issue. Next slide. Thank you. And so South Carolina specific, this is by county. And so what this slide tells us is that all the purple counties have pretty high eviction rates. And it actually is at the national level or exceeds the national level. We do know in South Carolina that South Carolina is one of the states that utilize eviction proceedings as essentially a debt collection tool. So we're high nationally, but this shows you how it breaks down by county. And the white counties are the ones that have a lower than average nationally eviction rate. And I point this out that it's 46 counties in South Carolina. 9 of them are under that. All of the other ones are at or above the level. The other thing that I did want to point out to this is, sometimes people attribute eviction to poor choices or, that there's just a series of unfortunate events. But really, if we take a step back and look at the cost burden of housing, generally the rule of thumb is that you don't want to spend any more than 30% of your household income on housing, a roof over your head, essentially. And unfortunately, we see that it's between 30 and 50%. So at the above 30%, you're moderate risk. At 50%, you're considered severely at risk of possibility of eviction and homelessness eventually. And so when you have that amount of your income, your household income going towards the roof over your head, you're in a much more precarious position. So it's not essentially necessarily a lifestyle choice, but it's really a choice of how much are you using of your hard-earned income on keeping a roof over your head. And then we also know, of course, that we have suffered unemployment, businesses contracted a lot. I know that there's been a lot of recovery, it's been uneven, but that absolutely ties into this. So if you don't even have a job or you're working less than you did, the part of your paycheck that goes to housing is even more. Next slide. Okay, so jumping to broadband. Broadband is one of the other issues that we've talked about. So, the eviction goes to affordability, which is one of the topical areas that CCF is very concerned about. Broadband is also another one because we see this as such an important element of accessibility, not only to work and employment, but to school, to be able to simply be able to function in, our current realities, COVID notwithstanding. So South Carolina ranks 31st in the country for broadband access. And, I want to point out that there's access and then there's also accessibility. So if you look at it, over 91% of residents have access to wired broadband connection in South Carolina with speeds of 25 MPS or faster. I don't exactly know what that means, but that's supposed to be a basic level. Seth will give us more information on that. But that means we have a pretty high percentage of residents in South Carolina who can have access. However, if you kind of unpack that a little bit, either over 500,000 don't have access to that particular speed, which is just basic, being able to function, or they don't have connectivity at all. So we did see that there are 522,000 residents who have access to only one provider, which is also an additional aspect as far as accessibility. If you only have one business that you can go to, your access is even further diminished. And so for me, really what's most important is, both of those issues. Having the broadband, having that ability is one thing, but very equally important is whether or not you have access to that. Next slide. So this is a great website, Broadband Now. You can go in and really dive in and drill into specificity on it. And this is a great resource, not only for us, but nationally. This one, what I want to point out is affordability a barrier? So I mentioned it before just a second ago, and it absolutely is a barrier. More than 52% of residents, only 51% of residents have access to low price internet, which the equation is $60 a month or less. $60 is still a lot of money. It's not considered a public utility, so it's not in the same bucket as your light bill or your water bill. This is, sometimes seen as extra. And in our 9-county footprint, so while there's 95% coverage in Charleston, Berkeley, Dorchester, Horry County is actually even higher than that. It's uneven across the state. So 88% coverage in Beaufort, Colleton, and Georgetown counties. And then our other two counties, Hampton and Jasper, have far less than that. And again, this is access. This is it's out there. It doesn't necessarily mean that people can take advantage of that or know how to take advantage of it and are able to secure it for themselves and their families. Interesting tidbit point, in Marlborough County is the smallest part of the state. It's not the smallest county in the state. It's not part of our footprint necessarily, but it has the least amount of coverage at a little over 33%. Next slide. Okay, so then this gets to how good is your access and speeds and all of that. This is the state. Essentially, it's very critical. We say that it's a lifeline. It absolutely should be considered something essential. Not only do you need it to work, we're all here online, hopefully not being dropped because we have terrible internet connection. We need it for school, we need it for healthcare. So many of us are doing virtual appointments with our physicians. So it's been great in that we're more accessible, but not everybody has it. So we'll see that the sort of purplish areas are what has really, really great broadband coverage. And the other areas have, not so great coverage. Next slide. Okay, so we have affordability, we have, the ability to engage in your world as we know it currently. And I do want to take just a minute on women and the pandemic. I know that the SHE session is a little bit of a tongue twister, but it has been talked about not only locally, but nationally. 2.3 million women have dropped out of the labor force since February 2020. Now that's national numbers, it's the Bureau of Labor Statistics, super important, but we also see that here, not only in our region, but in our state. And so, the hard thing is that 1 in 3 women, when they were queried in July of 2020, said the main reason was childcare issues. Women tend to be the primary childcare provider in households if there are 2-parent households. If there's a 1-parent household, then you're it. So I just wanted to set this in context that women have unfortunately been harder hit in so many ways by the pandemic than their male counterparts. Not to diminish men, not to any of that, but to just lift up that this is a really difficult thing for women. Mothers of children who had kids under 12 were 3 times more likely to have lost their jobs, to have lost work.
And I think as we have discovered, broadband access and stability of the network can be a challenge. And so I think we've lost Edie for the time being. Edie, I don't know if you can hear us, but we've lost you. And I know that this may be.
I can hear you now.
Okay, there you are.
Okay.
Feedback. All right.
So bottom line, women have been hard hit, and we're at a 33-year low of participation in the workforce, which means that women are often home with their children. You don't happen to have that income, and their family and the stability is at risk. And so if you go back to the eviction and how women are a little bit harder hit, there's a direct line to that. Next slide. Okay. So COVID and the economy. This is really now to just take a step and look broad, not only women, but broadly about who's lost their jobs. 10% of Americans ages 25 to 54, that's a very large range, but lost their job between February and April of 2020. While employment rates were single digits, unemployment rates were single digits prior to the pandemic. The pandemic actually has obviously increased unemployment rates pretty significantly. And unfortunately, people of color have been harder hit than their white counterparts. So while a lot of people may have lost their jobs, people of color and Caucasians in particular, whites have been able to get back into the workforce far more quickly then their Latinx partners, their Black partners, and other people of color. Next slide. And then this shows the unemployment rate by race during the pandemic. This clearly shows the disparity between Black workers and white workers. And then the last bullet is by August, the unemployment rate was 7.3 for white workers and then 13% for Black workers. Again, highlighting the disparity between people of color and white people. Next slide. Temporary layoffs. So the percentage of temporary layoffs, you'll see this little chart on the other side. Again, it underscores the disparities between Black workers and white workers and how the recovery has been uneven at best. Also, Black workers unfortunately reported being permanently laid off more readily than their white counterparts did. Next slide. Okay, so that was a snapshot. That was a lot. It covered affordability, eviction, women in particular, something near and dear to my heart, of course, and then generally unemployment in particular. And so I'll pass it back to Darren because he's going to set up our panel for a further dive.
Thank you, Edie. And I think if you sort of see the data, understand the implications for the data, you can become overwhelmed. And my hope is that over the next hour, not only will the panelists put this information in a little more context, but maybe give us signs of hope as we continue to do our work. And so I have the great privilege of introducing this panel, and what I'm going to do is just read a brief bit of their bio, and I'll start on alphabetical order as it's listed on the slide in front of you. I should note that Cynthia Bennett from the South Carolina Chamber of Commerce was supposed to be a panelist today. She was drawn away on some very important legislation for the state of South Carolina, working on a hate crimes bill. And so she will not be with us this afternoon. But it is my privilege to introduce to you Dr. Aditi Srivastav Bussells. Dr. Bussells is the Director of Research at the Children's Trust of South Carolina. She leads mixed methods research efforts on adverse childhood experiences, ACEs, health equity, community mobilization, and public opinion to improve family and community resilience. Dr. Bussells, welcome. I'd like to also introduce Dr. Ann Gowdy. If you have been with us before, you know that Dr. Ann is not new, but a return guest. And so we were kidding earlier, and she said that she's never been one not to be able to talk. And so we are so happy to have you back. Dr. Ann is a licensed clinical social worker and board-approved supervisor in the state of South Carolina. She serves as the Chief Program and Innovation Officer with Eastern Carolina Housing Organization and Secretary Treasurer for the South Carolina Interagency Council on Homelessness. Dr. Ann, thank you for being on the call today. Seth Ismail is a legislative assistant for House Majority Whip James E. Clyburn. Seth, you should know that I am a proud member of the Congressman's congressional district, and so thank him for his service. In this role, he advises on telecommunications technology and energy policy. And in addition, Seth leads the policy support for Congressman Clyburn's Rural Broadband Task Force, a group of 28 House members dedicated to closing the digital divide in our country. And then you've just heard from Edie Blakeslee, but just a little bit more from Edie. Edie leads and implements many of CCF's key community leadership initiatives, while also overseeing all of our grant making. Edie has been part of the foundation for nearly 20 years. She joined us when she was 13 and hails from Buffalo, New York, where she earned a Bachelor of Arts in English and History from the State University of New York at Buffalo. So thank you all for being here. I'm going to turn it over to you, Aditi, and you will give us a little bit more of where we are.
Sounds good. Thank you so much for having me. I think this is going to be an amazing discussion. I've been learning so much already, especially around the different data sources everybody's been using to paint a picture of what's been happening this past year. As Darren mentioned, my name is Dr. Aditi Srivastav Bussells. I am pleased to be here on behalf of the Children's Trust of South Carolina. We are your neighbors in Columbia, South Carolina, although we serve the entire state. We are the statewide agency focused on the prevention of abuse and neglect by strengthening families and making sure kids have positive childhoods. As a public health researcher myself, I always say that you can't prevent the bad without promoting the good. And so today I just wanted to spend a couple of minutes talking to you all about what we frame as the unintended consequences of COVID, particularly on kids and families. Next slide, please. For some of you, if you are familiar with the concept of ACEs, this pyramid looks familiar. For others, it might be brand new. ACEs, or Adverse Childhood Experiences, is really a term to help us understand why what happens to us in childhood affects our adulthood. So I think about it as a way for us to think about how all of those systems and decisions and communities and environments around us shape our very behaviors that determine our health outcomes. I really liked what Edie mentioned earlier, that not everything is personal choice, and COVID is a real example of that. Think about who were our essential workers. Think about who had the flexibility to stay home and provide childcare for their kids while work in their off time. Think about the inequities that we saw happen in real time. That's what we've been studying, but early in childhood. And so that's what I want to talk to you all about today, about how we're simply seeing a lot of those health problems that we've cared about for a long time in public health be exacerbated or be witnessed in real time because of this pandemic. So the whole concept of ACEs starts with this idea that when there are experiences early in life that are extremely stressful, so not stressful in the sense that I was 2 minutes late to this webinar, because that's stressful, but I can sustain that stress. I mean, stressful like it's unrelenting and it's been a part of your mind and body for minutes, hours, days at a time. It can lead to what we call toxic stress. And toxic stress occurs when a child doesn't have that buffering person or factor in their life that can make sure that they mitigate that stress and make them feel better. So through many, many studies, starting in 1997, when the first ACE study occurred, we actually found that toxic stress can lead to disrupted early childhood development. That means a kid can't learn, they can't grow, they can't connect with other people. And so what they're more at a risk to do is engage in those unhealthy behaviors we often try to prevent, like smoking or excessive drinking or unsafe sexual behavior. And as you all know, these risk behaviors can lead to poor health outcomes later in life. So when we think about this in the context of COVID, there's a lot of stress. Parents are experiencing things for the first time. There are first-time parents where their child has been in isolation, their entire existence. We're also starting to see things like kids really feeling the detrimental impacts of perhaps being virtual, because we know while that was safe in terms of keeping people from being exposed to the virus, there's certainly some unintended consequences that are happening. And so I really want you to think about ACEs as this idea of, it starts to make us ask the question, not what's wrong with you, why aren't you behaving in school, or what's wrong with you, you know that this is an unhealthy behavior. It makes you ask, well, what happened? What happened that led to this in the first place? And when we shift our thinking that way, I think we can really make some important changes when it comes to the health and well-being of children and families. Next slide. So another way to kind of think about ACEs are these three major buckets. There are a couple of animations, we can just pull them all up. ACEs really fall under three major buckets. Household dysfunction, so things that a child may witness in their household. It may not be something directly happening to them, and you can see some examples there. And traditional indicators of abuse and neglect. Now, my colleagues and I, who are very, very passionate about racial equity and justice, we've also started to move the field forward to think about community level stressors instead. So I think if you click one more time, you can see examples of what we now call community disadvantage, or experiences of poverty, racism, discrimination, things that are co-occurring in a child's life that may not, again, be directly happening to them, or they may not realize are directly happening to them, but are certainly shaping their early life experiences. And then when we think about some of the protests and calls for justice during COVID as well, we can see how some of these community level stressors may have played a role in a child's development as well. Next slide. So if there's one thing that you take from my very quick ACEs 101, full disclosure, we do full trainings for an hour and a half. So if your organization's interested, feel free to reach out. It's absolutely free. The one thing I want you all to take is that ACEs are really a way for us to understand risk behaviors for later outcomes. So the more ACEs that you report, the more bad things that you report early in life, the more your risk increases for all of these poor health outcomes that we try to prevent and are connected to a lot of other outcomes, such as homelessness, lack of opportunity, lack of productivity, and most importantly, early life, your life ending early, right? Early mortality. Next slide. So really, when we think about the impact of COVID on kids, there's a couple of things happening. And we talk about it in terms of three major kind of domains: health, safety and well-being, and education. And so the things I'd want to highlight here, and I hope we can get to some of it in our question and answer, is think about it as two things can be true. We tried to implement the best things we knew in terms of prevention when it came to making decisions, because what people don't often realize is that scientists were learning in real time about this virus alongside with us, right? And so there were things that maybe you felt like in a moment, well, why is this shifting? Why is this changing? Why are, kids going back to school in Richland County, but then they're, back virtual? It's because we were trying to figure out what was best. And in that process, we knew that there was going to be some unintended consequences. So I always say two things are true. We know that we were able to protect children and staff from being exposed to the virus by staying home. But we also know through the ACEs science that there could have been situations of where kids went back to the same toxic environments that maybe school provided a respite for. In fact, when we look at the Department of Social Services data, we've actually seen a steep decline in child maltreatment. And that's not because it's not occurring. It's because kids aren't around caring adults that are often their teachers, their coaches, people outside of their home setting that are reporting some of these things happening. So, what is the right answer? And that's something we're still trying to figure out. But I urge you all to really think about how we've seen these unintended consequences really play an effect on our health, our well-being, our access to education for kids, and then of course our safety as well. And then finally, my last slide just describes some of the unintended consequences in greater impact. You'll see on the side of your screen that I provided in handout, this is a COVID infographic that goes into much greater detail what those different things were, anywhere from how mental health distress increase to, childcare challenges that have occurred, to an increase of domestic violence in the home. And so as we are continuing to shape this full story of COVID and how it's affected us 1 year later, I think it's always important to recognize that there are certainly strengths and opportunities and of course consequences that we didn't really think about because we were so focused on making sure we kept the virus at bay, that must be considered in order for us to continue to promote the resilience and well-being of children and families. So with that, I will pass it back over to Darren and look forward to questions and discussions.
Aditi, thank you, and thank you for grounding us in what ACEs are, giving us some good perspective on that. And I'm sure there will be questions. And coincidentally, if you do have questions, please go ahead and type those into the question and answer box. You can do that now. We'll curate those and make sure that we get your questions answered. I'd like to turn over to you, Dr. Ann, and talk and share a little bit more about your work and what you see in terms of this last year.
Great, thanks, Darren, and I appreciate the opportunity to come back. And I will say that in this last year, we have embraced the disruption, we have seized the opportunities, and we have continued to think differently. So I want to walk you through the perspective and experiences through Eastern Carolina Housing Organization. We go by ECHO. Our vision is to create opportunities for folks in our community experiencing a housing crisis to find a place to call home. And we do that through trying to break those cycles of homelessness. So I want to walk you through over the last year from policy to practice to people. And starting in March of 2020, we have been operating in a whirlwind in the housing and homeless space. There has been an exponential amount of funding for emergency rental assistance and eviction prevention like we have never seen before. From a national level, the passage of federal legislation by congressional leaders has led to nearly $85 billion in emergency housing and homeless assistance since the start of the pandemic. One snippet from a state level includes South Carolina receiving a little over 10 years worth of emergency solutions grant funding. I'm going to say that again, over 10 years worth of emergency solutions grant funding in 1 year. At a county level, Horry County has also gone from about receiving annually $180,000 in a year for ESG funds to about $2 million. So now let's move from policy to practice and what that has looked like from our perspective. So out of the 13 counties that we serve in the PD and Grand Strand region, Horry is where we have the most of our community members reaching out for housing and homeless needs. Our agency has received COVID funding, additional funding from the VA, ESG, and also we serve as an SC state processing center. So to ensure that the funding for these much needed services were provided to our neighbors in need of housing stability, our agency went from about 30 to 50 team members in 1 year. We were able to expand our outreach efforts, increased our permanent housing programming, homeless or eviction prevention, along with emergency housing services. Next slide, please. Additionally, some of the new funding opened up for us to serve folks that we may not have served before. Said differently, some of the funding came with increases in the area median income or AMI requirements. Some of the members we've been serving, we would have never seen before. The need has definitely increased. So this slide shows for 2020 our move-ins to permanent housing. The rate of households receiving permanent housing was close to or above double ECHO's typical monthly rate 9 out of 12 months in 2020. Next slide, please. We were also able to prevent 193 households from eviction. That was about 455 persons. And as you can see on here and also on the previous graph, you see an uptick that ranged between April and June with a spike in those that we served. Additionally, we have had an unprecedented amount of emergency housing services, and this number is still staggering for us. We provided 28,924 bed nights, and that includes 233 persons with emergency hotel stays, getting them off the streets and into an emergency situation, looking to move them to a permanent one. So said simply, federal policy to state policy to practice to our community has had a huge impact on housing stability within our community. This has allowed for landlords to also be able to receive income as well, to hopefully be able to continue to use their rental properties. I know, next slide, please. Also, one of my pet peeves is explaining acronyms. So I've included in here a breakdown of some of the acronyms I may have used or you may hear in the future. Our language is technical and nuanced, so wanted to make sure you had it. One thing I just want to say in wrapping up, I know I'll have an opportunity in the Q&A to address a couple of other things, is we wouldn't be able to house folks and prevent people from being evicted if it wasn't for the landlords. And housing stock has been significantly impacted in Horry County specifically because folks are not being evicted at the same levels. Therefore, the availability of rental units is getting more challenging to be able to find. That's something we may not hear about as often. So we are very thankful for our tenacious case managers who are able to still find landlords willing to work with us. But I just wanted to point that out as well. Without rental units, then we are not able to house folks. So I will end it there and then save the rest of mine for the Q&A.
Thank you, Dr. Ann. And I'm going to turn Seth to you next. But Dr. Ann, there are two acronyms that I didn't see on your chart that I'm going to ask you about a little bit later on, and that's ESG, and then an example of AMI, just to have fun with the acronyms. So Seth, it is your turn.
Yeah, thank you so much, Darren, and thank you guys so much for having me. I'm calling from Washington, D.C., but I'm a lifelong South Carolinian, so it really is a pleasure to be with you guys today. As Darren said, I cover telecommunications, tech, and energy, and a few other things depending on the day for Mr. Clyburn. And broadband has been at the forefront of his mind for quite a while. What I'll say is over the last 2 years, or 2 years ago, he decided to start the House Rural Broadband Task Force, which is a group of 28 House Democrats with the singular goal of closing what we call the digital divide that I think Edie alluded to perfectly, right? It's an access gap, right? Just going back, we have 1 in 10 South Carolinians that we approximate don't have access to internet, any sort of internet infrastructure at all. And then when we talk about things like affordability, which I think is extra stark in the middle of a pandemic, we know it's even more South Carolinians and Americans across the country. And so the purpose of convening this task force was to work closely with the committees in Congress to come up with a comprehensive plan that addresses the access problem, but also the affordability problem and the adoption problem. So what I want to do just now is attempt to summarize what this legislation does. It's 200 pages, but just in broad strokes, what we're attempting to do here is invest over $80 billion for access across the country, and that figure is coming from an FCC study that was conducted to say that is how much it costs to put what we deem future-proof infrastructure across the country. So yes, we want to build infrastructure into the ground. Yes, we want to make sure everybody has connectivity as quickly as possible, but we want to make sure that connectivity is there not just next year or 2 years or even 5 years down the road. We are investing in future-proof assets, things that we predict can stand the test of time 30, 35 years down the line. So things like a fiber optic infrastructure that will upgrade as time goes on and as new demands happen with technology. What also comes with this infrastructure investment is requirements for things like affordability. So anybody that is getting money out of this new pot needs to offer an affordable option to any service that is offered on these newly built networks. And that's not only for low-income households, but for anybody. And when we think about the cost of internet service in this country, it's actually higher than all of our global peers, or most of our global peers. We start to think about how we really do have an affordability problem that goes into the household economics of not just low-income households, like I said, but also middle-class households. And so by requiring things like an affordable option, by promoting things like competition, by trying to get new providers in there, by encouraging networks that are what we deem open access, making it easier for people to utilize that infrastructure to offer competitive service, we are trying to lower the overall cost for everybody. But on top of that, what our bill does is it extends things that Congress has already done to combat things like affordability. Dr. Gowdy talked about these comprehensive bills that have come out to combat the crisis. And one of my favorite provisions that was in there is the creation of the emergency broadband benefit. And what that does, it offers a $50 a month discount for low-income service or low-income households to subscribe to internet service. Drastically either making it free or drastically lowering the overall cost for households to subscribe. What our bill does is it puts more money into that fund to make sure that we can get households through that emergency period as we build these new networks and as we work to lower the prices overall. And I think talking about a long-term permanent solution to that affordability problem, especially for low-income households, is going to be extra important as we go forward. And then what we do for adoption as well is we provide $1.3 billion for states and local entities and nonprofits to facilitate the meaningful use and adoption in the home. So we're building out the access, we're making it affordable, but we're also showing folks what the internet can do every single day and how to meaningfully use it for participating in healthcare, in education, and in commerce and labor as well. And so it's a piece of legislation we're very excited about. It passed the House of Representatives last summer. We have reintroduced it, and the president actually has come out with his own infrastructure plan that I think mirrors, or I think it's fair to say mirrors, the Accessible Affordable Internet for All Act. And we very much view it as the House Democratic position here. And we look forward to working with Senator Klobuchar in the Senate, who leads the bill, and also working across the aisle as much as we can just to make sure that we are delivering on this goal. And then what else I'll say is talking about the importance of broadband. Mr. Clyburn often compares it as the 21st century equivalent to electrification, and often invokes rural electrification happening in the 1930s here. So when we're thinking about, even before the pandemic, right, there was a homework gap. The folks who either couldn't afford or didn't have access to internet at home had to go to the parking lots often of libraries or fast food restaurants just in order to do their homework. Since the pandemic started, it's become an education gap, really, as folks have to learn and take their classes from home. When we talk about healthcare, when we talk about telehealth and making sure expert care is ready as soon as possible, no matter the zip code that you're in South Carolina, we want to make sure that there is reliable infrastructure in place so households can depend on it. And then during a pandemic, we know that in urban areas as well, folks who maybe can't leave home for whatever reason, or can't leave home because of the pandemic, can utilize telehealth there. And then I don't think I need to explain to anybody the importance of remote work and a reliable connection here, just as we are all a lot of us are working from home right now and depending on a stable connection as things go forward. So we're really viewing this as a comprehensive investment, and we want to get it right the first time. So, as things go forward, it really does feel as essential and as second nature as electricity does. So I'm looking forward to talking to you guys more about this in the Q&A. There's a lot of technical terms that go into it, but I think the basics and how all of this breaks down is a bill that everybody can see themselves in, because we know how important affordable access is to the internet and in everyday life. So I'm looking forward to working with everybody here and keeping up the discussion.
Seth, thank you. And I'm sure there'll be many questions for you about getting this thing across the finish line in the upcoming several months. And Edie, I will turn it over to you to round out the information portion of this, and then we'll jump into question and answers.
Yeah, great. Thank you, Darren. So I'll be quick. I know that there must be a lot of questions, and I did want to loop back to a bright spot, some solutions and some really positive momentum with the COVID Relief and Recovery Fund. It was seeded last year in mid-March with, a little over $100,000 with the partners that are listed on the screen. And the purpose was really to provide very flexible resources to organizations within our region who were trying to meet whatever was going on at the moment. It was really intended to make sure that nonprofits, because they're the lifeblood of a lot of work that happens in South Carolina, that they had some financial resources in order to pivot. I would really like to retire that word entirely at some point, but pivot and do the work, because they were asked to do more with less. And the big thing I will highlight is, it lasted far longer than we had anticipated. We generally do not run a disaster fund for this length of time. It is still operational and in the final wrap-up stage at the moment. But we have deployed a little over $2 million to organizations that have done such important work, and to underscore what Ann had said earlier, with creativity, with resilience, with just leaning into where we were and where we were likely going to go. Next slide. And you might wonder where that money went. It was specifically for our region, so from Horry County down to Beaufort, our nine county footprint. And this is how the dollars shook out, roughly about a third between the Waccamaw area, the Tri-County, and then the Southern Low Country, which we affectionately call the Southern Low Country. It's Beaufort, Colleton, Jasper, and Hampton counties, but that's essentially how it broke up. We were very conscious of making sure to spread the resources, because the donors were very interested in making sure that we didn't fund in only one area and not the others. Next slide. And then where did that money go? A lot of organizations, it was 141 grants thus far, although some organizations were able to reapply successfully and get funding. Bottom line is food and supplies were the big thing, making sure that people could eat, followed very closely by financial assistance. And our tag for financial assistance was essentially rent assistance, utility assistance, helping people stay where they were so they weren't evicted. And then The third is education, medical services. So the first couple months was really around food and shelter. And then as things wore on, we realized we needed to provide additional access for medical. There was some great collaborative work around deploying testing sites in rural areas. And then the education to really help nonprofits figure out how to support children while they were remote or whatever that looked like at whatever time frame. And there's a lot more detail behind that, but I want to make sure we have time for Q&A, so I'll close with that slide. Back to you, Darren.
Yep, Edie, thank you. And Gloria, I know you're operating the slides. If it's possible to take the slide presentation down so we can get a more full picture of the, yeah, there you go. So we can have we're all in the same space, not obstructed by a PowerPoint presentation, so we can have a conversation is what I like to have over the next 30 minutes or so. You know, and you brought up the fact that at ECHO, you guys embraced disruption. In business, there's this thing called disruptive innovations. And so I wonder, and each of you can address this, I wonder what'll go away as vaccinations get on the uptick, as people sort of see the proverbial light maybe at the end of the tunnel, as we get back to some sense of new normal and what we hope will be a fast-coming post-pandemic environment. What are some of the disruptive things, the innovations, quite honestly, that you have seen or done that will stay? What will stay, and then what will you not return to as a matter of practice in your own organizations? And we'll start with you, Ann.
Great, thanks. So internally as an organization, with the general question of disruption, we will look internally to find a way to keep all of our team members on their toes. So we know to expect change, but we saw the power of that. So a couple of things that were disrupted for us when we had to close our doors to the public, we had to get creative, and we made accessing our agency and applying for help available online. We put out press releases across our service area to get the word out to those who may not have internet access. We have actually seen a tremendous increase in folks learning about us and being able to reach out for assistance. So we are very thankful for that disruption. The other big one we experienced early on, we had to continue to house people without having contact. So we got creative with how you can still view a unit, communicate with the landlord, get documents signed, take pictures, etc. for all of those requirements. And our folks figured out how to do it and did it quickly. And so it pushed our folks to be creative. And so those are two examples of what was disrupted, what came out of it, and what we hope will continue is a mindset of creativity, openness, and one of our core values is impact, positive impact, looking at what we can do, not what we can't do.
Thank you for that. Aditi, you want to go next?
Sure. So there were a couple of things that, we plan to keep. So in addition to the research and evaluation that we conduct in order to improve kind of the services and programs that are working with children and families, we also support sites that provide direct services to children and families, namely through three major programs. So we house home visiting, the Positive Parenting Program, or Triple P, and the Strengthening Families Program. And what we ended up doing is we ended up delivering those programs online. We were learning as we went. And we found that in terms of access, it did actually increase access to groups of people we may not have been able to reach, either because the sites were too far away or the online nature of it made it a little bit more convenient. So I think we're continuing to have conversations on how we can take some of the benefits of virtual learning and balance it out with that much needed in-person connection that children and families need. And so that will be something that we want to continue to keep. I also think that while this isn't about, the virus itself, one thing that we were also grappling with as a nation was a lot of the protests and injustices that started around the murder of George Floyd. And so what we've also seen is having parallel conversations about inequities both in this pandemic and also inequities that exist in all other facets of our life. And as someone who's very passionate about that, I think that that is also something that we are going to continue to keep in the forefront of our minds, is that we cannot ignore the data that shows that children of color are continually detrimentally and disproportionately impacted by our child welfare system, among other systems. And so it's something that that energy around equity and inclusion is something that I hope we continue to keep post-pandemic, post everyone being vaccinated, because that is something that's going to take a lot of work for us to really move the needle on.
Thank you, Aditi. Edie and Seth, anything you want to offer?
Yeah, I will add two quick things. One is that we realized we did not need to come to you and meet you face to face in order to invest financial resources in your organization. Number two, I would say that, you know, Aditi, your point about equity and inclusion, it's a value. It's sort of what drives CCF, but this year has really pushed us in the most positive way into advocacy and policy in very important, meaningful ways. So for a community foundation, it's not all that common for you know, us to engage in lobbying or, you know, advocacy directly. There's often, you know, sort of a tiptoeing around it, that it's something that we can't or shouldn't do. And this has really given us the hard rationale for why it is so absolutely important, particularly when it comes to racial injustice.
Yeah, Seth, I'm gonna pause right here because I think you can add valuable perspective on just my attempt to sort of crystallize what I think we've heard from Aditi, from Ann and Edie, and that is this idea that the pandemic was what it was, but we had other issues, challenges, things that we have heard people say the pandemic shined a light on the inequities, the disparities, that the George Floyd murder last year sort of awakened this consciousness for some in our country for the very first time on some of the issues in the criminal justice system. And so we talk at the Community Foundation about this intersectionality between issues of economic opportunity and access, affordability of housing, education of our children, healthcare access and disparities, and the need to really bridge gaps between the public sector, the private sector, philanthropy. And so I wonder, as you think about the political environment over the last 13 months, as you think about the work that's ahead of us, and this polarized sort of time in which we find ourselves, what needs to stay? What needs to go away? Help us bridge this gap between what we know to be true in the lived experiences of so many Americans and so many in our communities, with what's happening in DC and the Congressman's desire to do broadband, the president's desire to do some big things for the country. Give us, I guess I'm asking a plea for hope here.
No, of course. Well, one, I think everybody is exactly right. I think this pandemic has shined a light on inequities that have already existed. The digital divide, I think as many of us know, disproportionately impacts communities of color, right? Children who face the homework gap, for instance, are disproportionately Black or brown. They are in rural areas. Oftentimes they're in tribal areas as well. And so when we are at a time where I think policy is always in people's lives, but I think it's very, very clear now. I think people follow politics more. I think people are seeing all of these programs start. People are seeing the overall response, that it just feels more intimate, I think, as the pandemic goes along. And as we start to realize these things, and as we realize these fault lines, to take messaging from the president's book, but certainly not to speak for him here, is we need to build back better, right? There is a moment here where people are more politically engaged than ever, where people want something done, and where we have to make moves forward. And I think we saw that with the American Rescue Plan, right, where we're starting to, yes, realize that we need pandemic relief here, but also what else are we doing to make sure that everybody, that there is an equitable distribution of funds. And I think that's something that Mr. Clyburn has been very focused. You know, he's the majority whip, but he's also the chair of the select committee on the coronavirus crisis, which looks at the way the pandemic has affected all communities, but also the way that these existing disparities has widened gaps in a lot of ways. And so when we're looking at ways to, again, build back better, when we're looking at, say, an infrastructure bill here that invests $100 billion in broadband, among many other things, we want to find ways to make this policy recognize the worlds in which we're operating, and also make sure that we are doing everything that we can to close these gaps and to realize that they're there, to acknowledge them, and to do a better job this time. Mr. Clyburn often invokes former President Truman, right, and the Truman Committee, who after the last New Deal, for instance, took a look at these programs to combat waste, fraud, and abuse, right, during funding, not the New Deal, but funding for the World War II, making sure that anytime we're doing these pretty ambitious government programs, that they are being made in an equitable way, and an effective way, and an efficient way. And making sure that the result is something that is accessible and affordable for every American. Now, whether that's broadband access, or whether that's healthcare, whether that's education, right? The list goes on and on. But I think that central message is very much on Mr. Clyburn's minds. And again, echoing everything that everybody else said about focusing on those disparities and making sure we're targeting them with any new funds or any new bill.
Yeah. You know, sometimes it's a little uncomfortable to draw the distinctions between communities, Black and brown, rural and urban. It can in many instances stop a conversation from really getting to where the complexity of those arguments really are distilled into very specific programmatic solutions, or even policy solutions. And so, Aditi, one of the first questions that we had in the chat was specific to you, specific to the work that you're doing around ACEs. And so, a person wanted to know what has been your research, and basically, so what have you found to be positive or otherwise the focus of your work? How have children who have identified ACEs, based on the work that you're doing, how's that going in the state of South Carolina? Are you seeing progress? Are you seeing with this focus? Are we doing better?
Great question. And to be respectful of my colleagues on the panel, I didn't want to go too far in depth in terms of the research that I conduct. So I gave you a very high level overview. So to the person who asked the question, feel free to reach out afterwards. I'm happy to talk more in depth because there's a lot of research I'd love to share with you. My research really focuses on, again, racial equity early in childhood. So along with studying adverse childhood experiences, I'm also examining what we call positive childhood experiences. One of the limitations that I see in the regular ACEs world is that the ACEs score, which is basically the number of negative things that you report, is with you forever, right? It's not something we can erase. It's just how it's measured, that, you know, if someone reports 4 things, they have an ACE score of 4. Now, the good part there is that the same research that shows us that all of these bad things can happen from toxic stress also shows us that with positive buffering factors in your life, or what we call protective factors, we can actually build resilience so that the brains actually can bounce back, and most importantly, bounce forward from these traumatic experiences. So of course, in an ideal world, we'd want to keep ACEs from happening altogether. But in reality, there's so much promising research and strategies and evidence around, despite experiencing adversity, there's many things that we can put in place that can essentially reverse those effects that happened early in childhood. And those are things like making sure that kids are in a safe, stable, nurturing environment like school or church. They're around a adult that continually reminds them of their self-worth and makes them feel like they are somebody that is worth it. It is having opportunities to succeed, opportunities to help others, opportunities to pursue higher education. It goes back to all of those, what we call social determinants of health, that we know are linked to positive health outcomes. And so absolutely, there is a lot of research that we've actually conducted that shows that we can mitigate the effects of ACEs when these positive things happen. Now, one piece of research I'd like to highlight is I recently conducted a study looking at ACEs amongst South Carolinians, and then engaging in what we call risk behaviors like smoking and alcohol use, and whether or not having a safe, stable, nurturing relationship reduced that risk. So as predicted, what we found was that when a person that reported lots of ACEs had someone in their life that provided that safety and nurturing environment, the odds of them engaging in unhealthy behaviors actually was significantly decreased. But when we look at it disaggregated by race ethnicity, we actually found that it had no effect on Black adults in South Carolina. And you might be wondering, well, why is that? Well, that's where that whole conversation of historic and systemic inequities come into play. You can have the best family situation or the most loving, caring parents, but when society sees you as less than, or society continues to treat you differently, or there are systems set up in place that can cause inequities to be exacerbated that are beyond your control, just having that doesn't end up being enough. And I think that's what really makes the case for, in the ACEs world, for us to think beyond individual level experiences and focus more on those community and policy level influences that can really make a difference in a child's life. And the last thing I'll share is that we recently did a study that looked at ACEs, COVID rates, and by race ethnicity in South Carolina. And we found, not surprisingly, that the counties that reported the highest rates of COVID were also more likely to be communities that had higher numbers of people of color, and also reported higher rates of ACEs or trauma. So it's all kind of linked, right? We are seeing that COVID is disproportionately impacting the same groups of people that have been historically disadvantaged and impacted by many other health outcomes as well. So those are just some tidbits of the research that I do. Happy to share more at another time.
Thank you, Aditi. And I will just tell you, I got a text message from someone who's on the call, and they said, I just want to shout amen as Aditi is speaking, because I think you are, as we would say, preaching. So preach on. Let me just ask this question. We're spending a lot of time sort of thinking about the year that was, and I wonder if you can sort of reflect over the next, out toward the next 6 to 12 months. What do you see on the horizon related to your organization or your work? I think, Seth, you sort of teed us up for this in a very good, politically appropriate answer to my first question. But what do you see happening the next 6 to 12 months? Edie, we'll start with you in the land of philanthropy and foundation, in the foundation world. And then we'll go to Seth, and then Aditi. We'll round out this question with you.
Great, thank you, Darren. So I think in the land of philanthropy, and particularly at CCF, there will be a continued focus and attention paid to how funding is allocated and whether or not that's equitable. We see it not only in national foundations with conversations, also very heavily within the Southeast, but for Coastal Community Foundation and Waccamaw Community Foundation and our partners, that's a very important conversation that we're having to make sure that how we are helping to deploy financial assets in particular is equitable and it's reflective of community. And so we are doing some initial analysis and data collection, but there will be more on that front, not only with us, but I do think with others in the field. And then, excuse me, the second is, I mentioned operational support. We have always funded operational support, but in 2015, we looked at what that looked like. And while we said it, we said, yes, we will give operational support. The reality is that less than 40% of organizations received just general operating support when they applied for a grant. And that was backwards. Like, we talked the talk, but didn't necessarily walk the walk. And so, a very important aspect for our work is to really turn that and provide larger percentages of operational support in our programming And so that when we say, yes, you can apply for general operating support, no, you do not have to find, the new shiny penny and present it, or it does not necessarily have to be a particular program. We really want that to be reflective in how we deploy those assets. But two very quick things. And I do think that will actually continue in the field generally. We have seen some foundations who had not previously ever given general operating support, and they actually have started to do so.
I think Seth, you're up.
Sure. Sorry, I think there was a bit of a lag for me talking about broadband here. I think it's sort of a twofold path. I think one is taking a look at the programs that have already been enacted through legislation and making sure that they're being conducted in an efficient, effective, and equitable way, right? So providing that continued guidance, providing continued technical assistance to make sure that everything is running smoothly. And then on the legislative front, the American Jobs Plan that Mr. Biden has laid out, we're looking forward to working with the White House and the Senate to try to deliver there, not only on infrastructure, but there's a phase 2 to the president's plan that also includes things like education, healthcare, childcare, as things go forward here. So I think what we're going to be looking for in the next 6 or 12 months from a legislative perspective is to work with as many elected officials as we can to get on the same page and to move forward on comprehensive legislation that, again, as the president says, build back better so as we go forward. So I think it is going to be largely focused on those two elements of things, and of course doing the regular duties of Congress, like funding the government and whatnot. But I think in addition to that, I think those two elements are going to be key. And being in touch with you guys, being in touch with folks on the ground, learning lessons for funds that have already happened, making sure that we are moving forward on the best possible policies we can is just going to be instrumental. So please keep in touch with all of us as this goes forward, and we look forward to continuing the conversation.
Thank you. Ann?
We expect the next 6 months to be tumultuous, and we are ready. With the exorbitant amount of funding, it doesn't flow down overnight. And so we are continually working internally within our agency to make sure that that can flow out as quickly as possible, while also letting our community know that we hear them, we see them, and we are working as hard as we can. Also, in the next 6 months, we are investing even more within our agency and our team members. Said differently, we are making sure we're taking care of ourselves, our team members are in a healthy place, and that we are working to make sure that we are not setting up our folks for burnout. We have new programming where we are looking to focus also on special populations of folks experiencing substance use disorder. And we also are continuing to invest in the training of our own peer support specialists and being able to, in a better quality way, serve the folks that we are serving. So we have buckled up. We have our roadmap, and we are ready to keep moving forward and serving our community in the best and healthiest way we can.
Thank you, Ann.
So for us, the next 6-ish months is really devoted to, rebuilding back some of the hope that we have seen be lost in time when things have gotten really hard. But also it's to really focus on how we can really start making an impact on all of these problems that have come to the surface. And so our organization is really engaging in an intentional strategic planning process, and we are working on really figuring out what our big bets are and what we can do to really align with other systems that serve children and families, as we have seen that is a need that really needs to happen sooner rather than later, as there's a lot of great work, but maybe sometimes people don't talk as much as they should about the different things they're working on. And then I think, like many other nonprofit organizations, we are really reckoning with our own, I would say, challenges with equity. So we are engaged in a company-wide book discussion called So You Want to Talk About Race? And there have definitely been some very hard conversations, uncomfortable conversations occurring. But, people are starting in different paths and journeys to understanding why equity is important, and that's going to be something that takes time. And we're looking forward to hopefully making some organizational practice and kind of culture changes to really promote equity and inclusivity in our work.
Yeah, thank you for that. And we've got about 13 minutes or so left. I just want to hit a couple of more questions. There was a question that just came through, and Aditi, you may be in the best position to answer this one. It's really related to over the last 13 months, people have had to work remotely. People who are used to being in the office with others, sort of as a social outlet. Students have obviously has pivoted to virtual learning, and there's a lot of question about the effects on mental health to that isolation. And I wonder if you could just talk about that in the state of South Carolina, if you have information that you can share about the effects of that isolation on students maybe, and then what are we learning about that issue in the field, and what can we do as I used to be in the military. We used to have this thing called a reintroduction. So when you've been away on deployment, you reintroduce yourself to the family, and it's a process. So as we reintroduce ourselves to community and society, any thoughts, perspectives on that?
Yeah, so there's undoubtedly an impact on our mental health. I mean, whether we're children or we're adults. One data point that is in that infographic is that about 80% of parents and caregivers reported increased stress during the time of COVID. And in that infographic, that is one of the handouts for this session, we talk about how when you can't cope with your own mental illness, how can you take care of others? And that's really where ACEs start to occur. Personally speaking, I've experienced the loss of 2 young people to suicide during this time, and they were both isolated. So we've also seen an uptick in, suicides and other dangerous and tragic circumstances that occur from mental health not being treated. And so we don't have exact numbers right now because we're living this and learning it as we are living it. But we do know that all signs point to social isolation certainly being a risk for increased mental illness. And I think that's also why you're starting to see entities like the CDC, the National Institutes of Health, other leading public health agencies saying, yeah, we're socially distancing, but we shouldn't be socially isolated. There's a lot of things that we can do to stay connected with people around us. While technology can be our foe, it's also our friend in many ways. I can't actually imagine going through something like this without having a smartphone. I don't know what that would have been like, being able to stay connected with friends that way. And so I think the work is really cut out for us in terms of providing some of those wraparound services in the education setting. We've also learned that teachers are expected to do way more than what they get paid for. And I think there needs to start being some real conversations about how we can overhaul our educational system to really provide that comprehensive support for students, where not everything falls on a teacher to do. And so I look forward to, I know the state legislature was taking up a lot of education reform this past legislative session, and I look forward to those conversations continuing, because we certainly have some work to do around making sure kids have access to mental health.
Yeah, thank you for that. And let me just pivot very quickly. Edie, I know we do a lot of work on racial equity, social justice at the foundation. I have a question here from someone who's asking, how do you go about educating boards to better understand the inequities that exist and how to address those organizationally as they seek to do a better job in serving clients? I think this may be a nonprofit person.
Yeah, no, it's a great question. So what I will share is our journey has been to not do something internally that we wouldn't do with our board externally, that we can't get too far out over our skis. The board is essentially our governing body, our bosses. They should lead our work. They shape it, they support us. And so we have taken the strategy of learning together and pushing forward together. After the tragedy at Mother Emanuel, we did actually take a very hard look internally at everything. everything from our vendor selection policy to how we hire, to how we recruit board members, to what our diversity statement was about. And I will share that at that point in time, we had a 2-sentence anti-discrimination statement. And so we did a scan and we realized we had a lot of work to do. And we recognized it at the staff level and we recognized it at the board level, and took a very methodical approach to revamping all of that. I will say we now have instead of saying what we don't want, we talk about what we do want equity-wise. And so we have a diversity, equity, inclusion policy statement. It absolutely addresses race, but it addresses diversity in all of its forms. So we weren't going to do it siloed a little bit at a time. We just did the whole enchilada at once. And that really drives a lot of the work that we've done over the last several years. So it's been hard. And it should be. I mean, this isn't comfortable, but our board has really stepped up, leaned in, and sort of been shoulder to shoulder in those conversations. And, remember, they're the ones who approved that policy. They're the ones who have said, you need to walk the walk and talk the talk. And very quickly, we tried to identify early on, based on some of our peers in the foundation space, we reached out to other community foundations that had suffered community trauma and said, what did you do? How did your board lead you? What did it look like? And in some of that discovery, we recognized that a lot of them brought in some expertise externally for training, for shared language, for all of that. And for CCF, we identified the Racial Equity Institute among a variety, but we selected them, that we actually do phase 1 of sort of their training around diversity, equity, inclusion. It's racial equity, but that was the very crystal clear spot that we started with. And they did that alongside of us. So they're all required. If you join our board, that's one of your requirements. If you join our staff, that's one of your requirements. We see it as professional development. And then we've identified a plan of action to make sure that we keep that conversation going. So we may have shared language, we may have some shared understanding, but then what? Like, how do you apply that? What does it look like? And I will say, I'll give a shout out to one of our board members, Herbert Drayton, who has really pushed and led the charge to make sure that the way we recruit and train and equip our board members is equitable, and that in all aspects of that, we do a much better job. So it's not a destination. It's a journey, and it's not like we've arrived. We see it as a way to continually improve and do that work. But it's a great question, because the board absolutely needs to embrace and do this work alongside everybody else.
Yeah, we get questions about this all the time in forums like these, as we reflect on, again, a very challenging year. I have to think that there are bright spots that really sort of circle around the opportunity to collaborate, the opportunity to maybe engage with and work alongside people that we probably didn't do that before March of 2020. And with the time we have left, about 5 minutes, I'll give each of you 1 minute to talk about that. What are the things you would like to see going forward in terms of collaboration and partnership? What can you lift up a best practice or an opportunity that you see as we go forward into the next year? And Seth, we'll start with you, and Aditi, and then Edie, we'll finish with you, and then I'll close this out.
Absolutely. Well, thank you guys again for having me. It's been a great conversation. And again, thank you for all the great work that the panelists are doing as well. Looking forward to staying in touch as we go forward. I think, speaking narrowly about the year, being open as we can, being open to one, I think as Edie said, about being uncomfortable, right, as these things go forward, and being open to the level of change that's needed to happen, but also just being honest about the experience that's going on, right, and being honest about the realities in which we need to improve, for everybody, right? I'm going back to, I guess, the messaging of building back better, but also identifying the existing disparities, the existing gaps, the existing work that needs to happen, and then facilitating a conversation about that and seeing ways that we can properly deliver improvement there. And so I'm looking forward to facilitating those conversations as best as we can, so we can translate that into meaningful action and improve the lives of folks across the country.
Thank you. Anne.
3 things: awareness, education, and increasing understanding. As Aditi said, we want more of other agencies and community members to be aware of us, be educated about who and what we're serving, and to increase their understanding. That has already happened at a state and a regional and a county level, and we are going to work hard for that to continue to happen, to help make those connections and to help move us all along. And we're going to continue to work hard to smash stigma of the folks we are serving experiencing homelessness or who are in jeopardy of eviction. We could all be one paycheck away, and that is important to us. And thank you for the opportunity.
Thank you.
From an ACEs perspective, one of the things I like to say is that ACEs aren't a kids problem. ACEs are a people problem. All of us have had childhoods, and all of us, know someone that has kids. We live in communities that have kids. And I really think that by setting up our future generation for success, despite some of the unique hardships they've experienced through this pandemic, is very much a goal that we can achieve. And I think that I'd like to see us really make that our collective goal, whether we work in business, whether we work, at a legislator's office, whether we work in homelessness or, preventing evictions. All of it's connected. And if there's one thing that I'd like for people to start thinking about, is that it's not just my piece of the pie that I need to be worried about. I really need to look at things more holistically and recognize that without our partners at the table and without people that have unique skill sets that can help with other aspects that absolutely have an impact on our lives, we're not going to really move the needle and continue to do things the way that they have been. And the status quo isn't enough. And if there's not a time that isn't telling us that it isn't enough, like, I don't know what else to say, then we should just not even try, right? Like that, I get really fired up about this because we have a really, really unique opportunity to do things better. And I think now more than ever, it requires us to get out of our usual spaces and try something different.
Thank you.
And so I will underscore that heavily and say, we have seen in the last year people willing to talk to others. So nonprofits not only talking to other nonprofits because they know they can't serve all of the need and they have to figure it out, but they've also started talking to the participants in a different way and asking them for what they need and what that looks like. And then thirdly, with all of those conversations and all of those pieces, it was born out of necessity. Like, we've got to do more. Nonprofit people have hearts. They want to do good and do better and all of that. But that actually then has crystallized that some of those things have actually formalized. So some funding. There was a collaborative effort around, the legal, the homelessness, the supportive services, and everybody came together to apply and share a piece of the pie. So it wasn't just simply, we're going to get funding and somebody's going to be the lead agency and these are all of our partners, but there were real partners with sharing of resources. And I do think, the bright spot is I don't see that going away. I see that increasing. The conversations about how to do that, how to be able to come together so that you can do better together. You're stronger together. And then to, Darren's point, you need to read reality truthfully. None of us, no matter how strong, can solve something, fill in the blank. We need each other to come together to do this work.
I am getting the proverbial hook because we are at 1:30. So let me just share a sincere thank you to Aditi, to Seth, to Anne, to Edie for your excellence today on this panel. Thank you all for joining us this afternoon. I'd like to thank our co-host, the Waccamaw Community Foundation, and our sponsor, Blackbaud, for making this possible. You can find out more information, just Google Coastal Community Foundation, look us up online, find out more about what we're doing, connect to the resources that are available in your communities. Again, thank you. We will see you again soon. Have a good afternoon.